Prehepatic jaundice. What is jaundice?
Jaundice is an increased amount of bilirubin within the bloodstream.
John and Jane Doe are proud new parents to their daughter, Jenna, who was born prematurely at 36 weeks. Mom and baby did not show signs of health concerns and were sent home one day after the birth. 3 days later, Jenna presented symptoms of yellowing skin and eyes. They are finding difficulty in waking her and breastfeeding, and they also notice that she isn't gaining weight.
Normal physiology. Bilirubin is circulated through the blood, attached to plasma through the bloodstream, where it is next passed through the liver, and the free bilirubin is absorbed into hepatocytes. In the hepatocytes, the free bilirubin is converted into conjugated bilirubin, which is passed through bile ducts and into the small intestine. Half of the bilirubin in the intestine is converted into urobilinogen, which is later absorbed into the venous blood or excreted in feces or in mild amounts through the kidneys. The urobilinogen that is not excreted returns to the liver to be excreted into the bile again. In a normal blood sample, a minimal amount of bilirubin is found in the blood.
JaundicePhysiology. Premature newborns produce twice as much bilirubin due to the shortened lifespan and higher rate of circulation of red blood cells. When the baby is born, the placenta no longer controls the elimination of bilirubin from the blood. In the affected physiology of a newborn, bilirubin cannot be processed by the liver fast enough in order to prevent the overaccumulation within the blood and tissue. The buildup of bilirubin in the blood destroys healthy red blood cells and also creates yellow discoloration in the skin and tissues.
Symptoms of jaundice: white chalky feces, symptoms of sickness or difficulty awakening, high-pitched cries, the whites of eyes may appear yellow, no weight gain, feeding poorly, and yellowing of the skin and deep tissue.
Diagnosis. Jaundice can be diagnosed through a physical exam, blood tests measuring the bilirubin levels in the blood, a skin test using a transcutaneous bilirubinometer. This measures the reflection of light that shines through the skin.
Risk factors may include premature birth, bruising during birth, blood type, and breastfeeding.
Causes may include hemorrhaging, sepsis, viral bacterial infections, incompatibility between mother's and baby's blood, liver malfunction, enzyme deficiency, abnormality of red blood cells.
Treatment. Possible treatment options for Jenna Doe include light therapy, intravenous immunoglobulin, and exchange transfusion.
Back to the scenario. Jenna Doe was treated using light therapy and breastfeeding was discontinued. She showed signs of improvement within 48 hours.
Light therapy is special lighting that changes the shape and structure of the bilirubin molecules, allowing excretion. Key concepts: homeostasis. It keeps an appropriate level of bilirubin in the blood for proper body functioning by eliminating excess bilirubin through the kidneys and feces.
Proteins. Due to red blood cell destruction, hemoglobin is broke down, causing an overaccumulation of bilirubin.
Cell membrane. Bilirubin passes through the liver. Free bilirubin is absorbed through hepatocyte cell membrane and is released from the albumin carrier. It then passes through the bile ducts into the small intestine, where half of the urobilinogen is reabsorbed into the liver and excreted into bile again.